Hi, this is my week 4 cardiovascular soap note. I got JJ who came in. He's a 35-year-old male who's a Caucasian American who came by himself and is a reliable historian with a chief complaint of abdominal cramping and bloody stools yesterday. So what makes this soap note cardiovascular is that his reading at the clinic was 145/90. So for old carts, the onset, it's it's been going on starting about 2 years ago, and he's been checking it at home with consistent readings of the top number being above 140. Similar findings at the clinic. He doesn't notice any symptoms associated with it, like shortness of breath, chest pain, palpitations, leg swellings, headaches, anything like that. He hasn't noticed that it's worse in the morning or at night or at the clinic, and it hasn't stopped him from any activities of daily living. So his past medical history has ulcerative colitis that he comes in about once a year for a flare-up, and he gets a steroid dose pack. No surgeries, no medications, no allergies. Family history, his dad had 6 MIs starting in his 40s and eventually died from them in his 40s. His paternal grandfather also died from a heart attack. He was not sure of the age on his grandfather. On his mother's side, maternal, no medical history, still alive, and uh, grandparents on the maternal side, still alive, no medical history. And then his grandmother on his paternal side, still alive, no medical history. So, review of systems. Constitutional, he denies any fevers, chills, pains. Cardi- Cardiovascular, no, he denies any chest pain, shortness of breath, palpitations, leg swelling again. Uh, Respiratory, he doesn't report snoring or headaches or people telling him that he stops breathing in his sleep. Um, so for and gastrointestinal, he has the abdominal cramps with the bloody diarrhea that he reports. For social history, he's married, works the night shift at the prison, denies smoking and drinking. Vital signs: heart rate 95, blood pressure 145/90, temperature of 99.5, respiration rate 16. He's 5 foot 4 inches, weight of 174.5 with a BMI of 30.1, statin at 97% on room air. So, physical exam, constitutionally, he's obese. He has a slight grimace on his face from pain, shifting in his seat. Cardiovascular, strong regular pulses in all 4 extremities. Uh, Heart sounds are lub-dub with no murmurs. Respiratory, clear in all fields, in all lobes, and gastrointestinal, hyperactive in all 4 quadrants, soft, non-tender. So for the assessment, the differential diagnoses I got are primary hypertension, renovascular hypertension, and secondary hypertension due to obstructive sleep apnea. The primary hypertension, he's consistently tested with high blood pressures for the past 2 years with no real identifiable cause. The renovascular, it's a lot less likely with less than 10% of people with hypertension having that diagnosis, and he hasn't had treatment failure of the with any medications for his hypertension yet. And then the obstructive sleep apnea, secondary hypertension, he denies any snoring or headaches in the morning and fatigue. So the primary diagnosis is primary hypertension. The plan is to do for diagnostics regular blood pressure monitoring at home and at the clinic. Laboratory tests, we want to check the metabolic panel to check for kidney functions, to do the initial rule out of renovascular problems. And if it's persistently not treatable, if he has treatment failure with the medications, then we would do a sleep apnea test. The treatment's going to be 10 milligrams of lisinopril once daily, starting off, and then a burst taper of prednisone for 3 weeks. So for lifestyle changes, we're going to focus on a heart-healthy diet, low sodium, promote physical activity. Education, we're going to talk about checking his blood pressure, how it elevated blood pressure, it puts you at an increased risk for like heart attacks and strokes, which he knows about with his dad already. And then we want to follow up with him in 4 to 6 weeks to see if the lisinopril works. Thanks for watching, everyone.